a good officer will not ask his or her soldiers to do something they are not prepared to do themselves. That's why it's important to focus on some of the little things. It's why officer standards on things like the commando course are more stringent for enlisted soldiers, and it's why the Royal Military Academy is based on the ethos of serve to lead. And is also why in the office of the Chief Medical Officer, I was the one who did the shoes. There will be usually a Monday morning when people would be walking around in their socks in our office, and I would have 8 or so pairs of shoes, and I'd be there doing the shoes. But that was important for me to communicate that I'm prepared to do things and not asking other people to do things that I won't do myself. One of the things that kind of grips me daily is the idea that you've got to get to the end of your working career and be pleased with yourself about what you did, and to have as little regret as possible. And part of that is knowing when it's your time to walk. You have to get to the point at the end of your career when you can look at yourself in the mirror and say, this is what I did, and never mind what other people think. Make your own judgment about if you really gave it the best you could. It doesn't matter what career you have, doesn't matter what trade, profession you have, you have to look at yourself at some point and go, did I do the very best I could? And what you have to do is unpack that when you're in this sustained crisis mode, and at whatever time of night it is when you say, right, that's it, that's the last email, that's the last call tonight. You have to say, have I given what I could do today my absolute very best? And if the answer is no, then go and do a bit more. And if the answer is yes, then go rest, and with a clear conscience.